sometimes for many years to get a new code, as you know, through pharmaceutical is quite a lottery sometimes. From our point of view, to try and keep the cost down, we brought our product in to fit into a pre-existing code that was there. Similar products that are coming to the market are way outside of the L codes that are already existing, so which is driving the cost up, making these things only for a small percentage of the market, where by bringing a product in with inside the existing L code already on the reimbursement scale, is a lot more availability to the population as a whole on the amputee side.
Thank you. Well, as we all see from attending CES, there is a tremendous amount of technology available today. And when you look forward, how do you see digital health evolving?
I see the opportunity here is in the data. I think the examples are, blood pressure, temperature, being examples of everyone assumes that 98.6 is a normal blood pressure, or 120/80 is your 120/80 is your normal blood pressure, or your temperature is 98.6. It's not. You are your own control. And so the data sets that we're going to be derived and the analytics that come from that will be the first phase of this. And the second phase is literally the changing of care. How are you going to use this data in a pattern or in a way that's beneficial, that we see other people use data that we never thought of? And I think there's a real opportunity to use the data and the analytic capability of the technology that exists, the pipes, the devices, in some meaningful way of either preventing disease or health degradation or disease progression.
So I actually think the data is going to go away and become completely invisible to the end consumer and to the clinician in some way. I think the data will be there, but the data will be an engine that will be driving applications that people engage with. Clinicians, patients don't understand what half the data means. Clinicians don't have time to look at vast quantities of data. So it's our job as designers and creators of solutions to create the abstractions that will engage people and will motivate them and will incent them. So leveraging things like game dynamics, which you see being used in the consumer space all the time, I think we're going to start seeing more and more of. We're seeing it right here. United Healthcare has that little game that they're playing in their booth, where the person who walks the most with their pedometer gets a prize. So I think we're going to be moving more towards abstractions and more towards applications where the data is invisible.
I think in support of that, the analytics that you gather from the different sensors that we have, I think many of us here, I think it's enabled by a very robust broadband connection. So I think from our perspective, things like the National Broadband Plan are just revolutionary, because for delivering the kinds of solutions that we're talking about, you're going to need a very reliable, robust, cost-effective broadband connection. And I think doing some of this over the Wi-Fi network, as the technology allows us to do this with very long-lasting battery life through these kinds of devices, makes an IP-based sensing system that brings the information back in, and it really allows us to do it in a very cost-effective way and a quick installation. But to do that, we have to have robust and reliable broadband. So way to go, FCC, FDA.
From our point of view, going forward in the technology, from our point, it's going to be control systems. It's getting more function out of compliant hands. Being able to make the complex movements that I touched on earlier is going to come down to much greater control from the patient. Now, some of that can be down to pattern recognition, and some working with some of the universities here in the US, also working in our own company in the UK, doing some research into this. I also been partnering with some people who are working on the brain mapping, trying to get signals, reliable signals to make complex movements of compliant hands. So as much as that we've come across with a product, we are still looking to work very closely with people who have some maybe greater technology than us, and work that's been done and studied over the years to bring the two products together to give the patient the best possible results.
Thank you, Richard.